Why propranolol tablet is of 40 milligrams, but injection only 1 milligram? Why nitroglycerin is always given sublingually and not orally? To understand all of this, let's learn pharmacokinetic in fun and easy way with me. It is all about the journey of a pill, in, through, and out of the body. It is about ADME, absorption, distribution, metabolism, and excretion. Let's talk about absorption. Two important topics to learn from it are Firstpass metabolism and bioavailability. If you take a pill, does it directly reaches the blood circulation? No, it do not directly go in blood. It has to go through our gatekeeper, which is liver. When you take a pill, it may happen that liver metabolize 2/3 of it and 1/3 of a drug only actually reach the systemic circulation. That metabolism of a drug by the liver, even before it reaches the systemic circulation, is called first-pass metabolism. And that portion of the drug which actually reaches the systemic circulation, it is called bioavailability. When the drug is given by intravenous route, it directly reaches the blood circulation. So when given by IV route, it has 100% bioavailability. When the liver is healthy, those drugs with very high first-pass metabolism reaches the blood circulation in a very small amount. But if liver has a problem, for example cirrhosis or liver failure, that amount reaching the blood circulation becomes many times more than usual, and this could lead to dangerous side effects. Those drugs which have almost 100% first-pass metabolism cannot be given by oral route. We have to give them through injectable or sublingual or other routes. That is why propranolol has 40 milligram tablet but only 1 milligram injection.